My name's Tim Spector. I'm Professor of Genetic Epidemiology at King's College in London and Director of the Department of Twin Research. Last March, when the pandemic was hitting and Europe was being overrun, we got a call that we had to shut down our twin studies and we all had to start working from home. This was about the 18th of March. And on my way home, while cycling, I started thinking, oh, this is very depressing. This is lots of people's jobs and life's work. How can we continue the research in some meaningful way? And knowing we had all these twin volunteers, I came up with the idea of contacting them by app. King's was the perfect environment to put an app like this together rapidly.
My name's Claire Steeves and I'm a reader in epidemiology at the Department of Twin Research in King's College London. And I'm also a geriatrician. Tim, came along to me and said, I think we really need to use what we've got within Twins UK to try and understand this disease and maybe track the symptoms, how they progress, etc., within our national cohort. So we developed a schema for how we were going to design this reporting system on an app.
We had no official support at all. It was all driven by people who were desperate to communicate, do something for the pandemic, and felt they'd been ignored. And within a couple of weeks, we had 2 million people. Our servers crashed.
And it was at that point, once we got, we'd realized how much data we were going to be getting through and how much we were going to be able to do.
So with this massive data, the key was to have people who could handle millions of data points and were used to it. And it turned out that the health engineering department of Seb Orsolin, which is world famous, were used to having massive data sets, even more than my own epidemiology department, who definitely couldn't handle this. So most of our data is really collaborative. And that's one of the exciting things, working with the best people around the world.
The other really amazing thing, I guess, about the app was this ability very quickly to create maps of the country, see where the cases are. And that was so good to be able to feed back to participants so that somebody could actually on their app see what their regional rate is.
Around 8 out of 10 of our predictions came true. We were very proud of our major achievements. Mainly was around symptoms. We'd heard that loss of smell, anosmia, was a possible symptom. Reports from Italy and from ENT surgeons, but we were the first to actually show that it was related to being positive on a PCR test. And that fact alone showed it was the most predictive single symptom of COVID. And after 2 months of lobbying, we managed to get the government to add it to their list of symptoms.
So the really amazing thing about being a researcher in King's is the real breadth of science that we can pull together to help some kind of project, some kind of real crisis like this. And so it's in King's that we have this real strength of clinical expertise working alongside epidemiologists, statisticians, and also engineers, software engineers, and people who work within machine learning and so on. So it's that combination of real hardcore data science, hardcore epidemiology right next to the clinical understanding that allows us to produce things like this so quickly. It's the collaboration between scientists and the public that has really made this such a success.
And I'm very proud of the work that this huge team have done. We're getting this incredible bond with the people using the app that hopefully is going to continue and really show us a new way of doing research that we hadn't thought about before, because you can do research on 100 times the scale at a fraction of the price. And I'm just a spokesperson, but there are approximately 70 people that deserve all the credit behind the scenes.